Welcome, this is First Aid, Module 3, Week 3, and we're going to now be looking at the final part of this course before we get to the assessment part. We're going to start off with choking and blocked airways. Just remember, before, what we've done is we've looked at the assessments in the first week, how to deal with emergency situations, what are the basic symptoms to look for. In the second week, we looked at the CPR, rescue breathing, and a little bit more detail in some of the things that we saw in the first week. And now we're going to be continuing with other areas like blocked airways. We're starting off with choking. Now, when a person is clutching his throat or her throat with both hands, they're making a universal sign for choking. So they go like this. That means they're choking, right? If they can cough or talk, they need to try and do that. But when they can no longer talk or no longer cough, then you realize that they've got an obstructed airway. And to clear this, you must perform abdominal thrusts. All right, so how do we do this? First of all, in an adult, you stand behind the conscious choking adult, wrap the hands around his or her waist. You make one hand, make a fist, place the thumb side of the fist against the victim's abdominal, just above the belly button, and be sure your hand is far below the tip of the breastbone. Put your other hand over the fist and give quick upward thrusts into the victim's abdomen. So again, the thumb side of the fist against the victim's abdomen, just below the belly button. Not too high, below the belly button. Sure the hand is below the tip of the breastbone. And then the other hand goes over, and then what you do is you then give upward thrusts to the victim's abdomen. You continue giving these thrusts until the object blocking the airway is dislodged and they begin to breathe, or until they become unconscious. If during the primary survey, because remember this is one of the areas in the primary survey is breathing, etc., the breath would not go in an unconscious adult, you've retilted the head, you've done all of that, you assume that there's an obstruction. Therefore, this person is choking and consciously choking. Once they become unconscious, you can then lower them onto the floor, onto their back, and then you perform the same thing, the head tilt, chin lifted up to open the airway, and you attempt to remove the obstruction by sweeping it out of the victim's mouth with your finger. That's called a finger sweep. And you always use a hooking action. Why? Because you might just push whatever it is further in, so it's hooking. Right. You perform the head tilt and the chin lift, and you give 2 slow breaths. If the breaths still don't go in, then you start the abdominal thrusts, which is you straddle the victim, both of the thighs, you place the heel of your hand on the victim's abdomen and above the belly button, yet far below the tip of the breastbone. Place your other hand on top of the first, interlacing your fingers, and you give 5 quick upward thrusts. You then do a finger sweep and give 2 slow breaths. Now it's important to do the finger sweep after this, because whatever hopefully is dislodged is then sitting there, and then you need to take it out. Otherwise it'll just go back. Now if air still doesn't go in, then you will continue giving abdominal thrusts. And you do a finger sweep again, and then you do 2 more slow breaths. And you continue doing this until the object is dislodged. Air goes into the victim, or unless a trained emergency personnel will then come help and take over. If the victim's still not breathing, but now they've got a pulse, then you perform the rescue breathing. And if the victim is not breathing and does not have a pulse, again, then you will go to CPR. So again, we've looked at the CPR, we've looked at rescue breathing, and now we've looked at the abdominal thrusts, which is to try and dislodge things that might be blocking the throat. Let's now look at the child. Choking in a child, again, it's the same thing. If you ask them to cough, you ask them to to talk. If they can't, then they're choking. You will then do the abdominal thrusts again. You place the victim, stand behind, wrap your hand with the fist, put the thumb side against the abdomen above the belly button, yet far below the tip of the breastbone. Put the other over the fist and give quick upward thrusts. So again, it's above the belly button and far below the tip of the breastbone. So the breastbone is here, it's far below, but it's above there. So it's the abdominal area here. And you will do that until the child becomes unconscious, when you will then have to put the child down, lower them into their back, and then do the tilt, check if air goes in. Then you do the finger sweep. You then do abdominal thrusts while they're lying down, as you've seen, while holding their hips, so that you can then push the abdominal thrust. Do the finger hooking action to try and get it out, and then trying with slow breaths. So it's the same thing then with the child. With the infant, you give 5 back blows and then 5 chest thrusts. So here it's very different. And again, you will check, is this infant able to talk? Are they able to cough or cry, whatever? If they're not, then that's what you do. 5 back thrust blows and 5 chest thrusts. Again, what you do is you place the infant face up on your forearm. You put the other arm on the top of the infant, use your thumb and finger, holding the infant's jaw, sandwiching the infant between your forearms, and turning the infant over, face down on your forearm, placing the arm down on your thigh, and being sure that the infant's head is lower than his or her chest. Using the heel of your hand, you give 5 back blows between the infant's shoulders with the blades. Make sure that their jaw is held with your thumb and fingers so that their head doesn't go flying. You then turn the infant back over there to give them back chest thrusts. And what you here do is you take your free hand and your forearm around the infant, sandwiching him between your forearms and supporting the head. You then turn the infant over again on their back, place your arm down under your thigh, making sure that the infant's head is lower than his or her chest. Imagine a line across the infant's chest between the nipples. Place your ring finger on the infant's breastbone just below the imaginary line. Place the pads of the next 2 fingers just under the line. Raise your ring finger, and if you can feel the notch or the tip of the breastbone, move your fingers up a little bit. Compress the infant's breastbone 1 or 1.5 inches with the pads of your fingers, and then let the breastbone return to its normal position. You give 5 compressions. You then give back blows, chest thrusts until they can breathe or cough. Now, if they've got a conscious choking victim who becomes unconscious, again you put them on their back. And then you do a primary survey, and you retilt again, and you check if the air goes in. If not, you do the back blows and the 5 chest thrusts as we've said. You then do a foreign body check. Open the mouth, hold the tongue, lower the jaw, lifting them upward, and look for any object, and then do a finger sweep to remove it with your little finger. You give 2 slow breaths, and if it still won't go in, again you do back blows, chest thrusts, foreign body check, and again 2 slow breaths. If there is no pulse, then you can start CPR, and that's what you then do with the infant. Now let's look at bone injuries. What do we do for bone injuries or fractures? The first step is you don't move the patient with a broken bone. Why? Because you move them, the bone can become more fractured, become worse. So you keep them stable. You call emergency services then, and then what you do is you move the patient, immobilizing the injured part of their body. For example, you can use an injured leg, you can use to an injured one, or an injured arm to a chest. This is called an anatomical splint. So what you're doing is you're using the part of the body that's injured to an uninjured, and that becomes again like supporting that injured part. You then can make a soft splint using blankets or towels. You can get a triangular bandage to make a sling. You can also use magazines or even newspapers or cardboard or metal strips to support the injured body part with that splint. So there's several, you can use several folded triangular bandages to secure this injured body part to the splinting material. And what you do is you tie them securely, but obviously not too tight because that stops the blood flow. You can apply ice and you can raise the injured part and prevent the victim from getting chilled or overheated. And of course, when a person's got a bone fracture or injury, keep reassuring them because you don't want them to go into shock. Muscle injuries. Okay, here we have number one, you need rest, ice, and elevation. Those are the three main things for muscle injuries. Rest, elevation, and ice. Make sure they're comfortable and apply the ice to reduce swelling. Minimize again the movement of that injured part by putting it onto something like a pillow, and that should help it at least for the moment. Let's look at burns. Now burns, you first of all have to stop the burn. So you put out the flames, you put out the source of where the burn came from. You then cool the burn down. Usually cold water or ice. Don't use ice except on superficial burns. Why? Because it's not going to help that much if it's deeper. Again, don't put any ointment on a burn unless it's very minor. Don't use any other home remedies. Don't break any blisters. Okay? For minor burns or burns with broken blisters that are not severe enough to require medical attention, wash it with soap and water. Keep it clean. You don't want it to get bacteria or to get, you need to apply an antibiotic cream or ointment. And just be careful, some people might be allergic to certain ointments. If you have any doubt, obviously then call the doctor. Check the heart rate and protect the victim from drafts, because you don't want obviously cool air to affect them as well. 4, chemical burns. So here, this is caused by chemicals obviously, and this could be anything from bleaches to garden sprays to pool acid, etc. In the case of a chemical burn, you call emergency services, always. Remove the chemical from the skin or eyes immediately. So that's the first thing you do, is to remove it just as you did the heat or the source of the burn. You then have large amounts of cool water running until the emergency services arrive. Remove any clothes with chemicals or on them, because obviously you don't want it to get worse. And if there are electrical burns, these are caused by things like power lines, electrical equipment, unprotected electrical outlets, etc. Again, you call emergency services in the case of this electrical burn. Don't go near the victim unless you're sure that they are not, still attached to that electricity source, because obviously then you'll have 2 people dying. The burn itself will not be the major problem, obviously, because it's going to rather be things that it does, like the shock, etc., and the heart. If they're unconscious, then you can check their pulse rate and their breathing. If there are other injuries, don't move them, obviously, until you've assessed if they have any other injuries, spinal, head, or neck. If you've got an electrical burn, you can cover it with a dry, sterile cloth, and don't cool the burn. Prevent the victim from getting chilled. There may be 2 wounds, one where the current entered the body and one where it left, so they may be deep. So just check where it goes. If it is an inlet and outlet to the burn, it might actually have gone all the way through. Okay, let's look at the cuts now. How do you deal with that? Okay, the first thing for a cut is you need soap, hot water, cotton wool, gauze swabs, antiseptic, plasters, non-adhesive dressing, or clean tissues and gauze bandage. Alright, so obviously what you do is you wash your hands. You then clean the wound. Press the wound with the thumb and finger until the bleeding stops. You then rinse the wound under a tap if it's dirty after you've stopped the bleeding. You then use the cotton wool or gauze, clean it with soap and water, and work from the center of the wound outwards using a clean swab for each swipe. Okay. We then finish with some undiluted antiseptic. Not diluted, obviously. Must be very strong. You then pat the skin thoroughly dry, and you remove any smaller pieces if there's glass or gravel or anything where there could be things that have lodged into the skin with some tweezers. And if it's a small cut or graze, then you can just put plaster on. If it's larger, you can use the non-adhesive dressings secured with a gauze bandage, which you will tie firmly, but not so that it stops circulation. Okay. Now, never put the fluffy dressings like cotton wool next to the wound. Why? Because they'll stick to it, and it's painful when you pull it off. And it will dry in it, and it's very difficult. So only handle the very edges of the dressing. Now, let's look at injuries to the head, spine, neck. If you have these signs that we've spoken about, loss of consciousness, vision, breathing problems, nausea, vomiting, headache, seizures, pain, anything like that, loss of balance, you'll look for things that could be affecting the head, neck, or spine. Minimize the movement of the head and spine, maintaining an open airway. In other words, you lift the chin slightly, don't tilt the head, otherwise you might paralyze the victim, especially if there is damage to the neck or the spine. So therefore, very, very gentle movement to open, check for consciousness and breathing, and control the bleeding. Then you prevent the victim from getting chilled or overheated. Okay, so that's how you deal with the head, neck. And again, you do not move those areas. You keep it very, very secure. Shock. Now, shock is serious, as we said, and therefore you would call emergency services immediately. They would lie down